Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up in just a few minutes in our Going Deep segment brought to you by CO2Lift. Today we're featuring Dr. Michael Reed. He's a skilled cosmetic gynecologist who is passionate about helping women feel confident and revitalized. With over 22 years of experience in women's health, he's dedicated his career to mastering cosmetic gynecology and staying current on advancements in the field. He takes a holistic approach to patient care, combining non-invasive methodologies with hormone therapies and surgical procedures to deliver thorough and personalized care. His patients include Hollywood A-list celebrities, foreign royalty, working mamas, and single women, all seeking awareness, options, and a solution to improve their health and revitalize their sex lives. As a board certified OBGYN, Dr. Reed truly understands the anatomical intricacies of genital plastic surgery, and he has an aesthetic eye for creating beautiful, natural looking results. Who wouldn't want that? Now, sex and sexuality are part of life. Clearly, aside from reproduction, sex can be about intimacy and pleasure, as it should be. Sexual activity offers so many surprising benefits, and sexual health is more than just avoiding diseases and unplanned pregnancies. It's also about recognizing that sex is such an important part of your life. Today, he joins me to demystify sexual shame and talk openly about women's health and wellness, chatting about the health benefits of sexual pleasure, how to maximize celebration of self, and the many proprietary benefits of carbon dioxide therapy for vaginal rejuvenation. That's right, you've heard it trending, carboxytherapy. Welcoming now to the show is my expert on the microphone, Dr. Michael Reed. Welcome, superstar.
Hey, man, that was amazing.
Let's dive right in. Now, we might not all want to admit it, but most of us have a preferred word for vagina. Of course, I'm all for those who prefer to solely use the correct anatomical term, but vagina nicknames are in fact here to stay. And a lot of them are quite funny. And really, life is boring when it's not spent having a bit of laughter over terms like lady garden, right? So, Dr. Reed, what are the top names that you have heard women refer to their vagina?
I've heard all kinds of names. We hear cookie, box, muff, my down below, my. But the crazy thing is, why aren't we using vagina and vulva? I can't even use it on the internet. If I try to share and educate using appropriate terms so that we can get rid of the shame behind the word vagina and vulva, I'm immediately shadow banned. So the important thing that our audience needs to know is, hey, we need to fight for the fact that I can use the word penis on internet and Instagram, but I can't use the word vagina and vulva. And that's where the real problem is.
I couldn't agree more. We're at the beginning of redressing the wrongs and misinformation around this neglected organ, but so much more work has to be done. In 2022, a study by gynecologists at the University of Manchester, England, found that less than 10% of women could accurately label female genitalia. Like the clitoris is even more taboo than the vagina, and arguably the most neglected human organ by medicine. It's still inadequately depicted in most medical textbooks and barely touched upon in medical training. And this is a very serious problem. To your point, women have been injured by this lack of knowledge through botched
Absolutely.
reconstruction surgeries, anti-incontinence procedures, obstetric tears and repairs, and vulvectomies. So this is something that we have to address. But going back to addressing the misinformation and the uneducation of the medical community, why do you think there's shame and embarrassment in the word sex and vagina? Is it cultural?
It's a societal thing. I mean, you got to think about it. The United States is obsessed with sex. We are obsessed, but we want to act as though we don't want to talk about it. We use terms like my private parts. Well, what about my personal parts? There's sex in itself, sexual desire in itself is a need, not a want. It's a need, it's a human need. And I think today, in today's society, that shame is carrying over and it's affecting women and their ability to fully experience their sex life equally as men do. I mean, women are kind of have been left behind. It's kind of like they've been sitting on a shelf. And after you deliver babies, Nothing else matters. Whatever longevity you have in regards to your vulva and vagina, that's all you get. And so I personally feel that it's a human need, and why there is shame, we have to eliminate it. We have to eliminate it. One of the things you were talking about was education. How can we educate women and get them to educate them quickly? I'll give you one quick thing that would educate women uh, quicker than anything else. If I could get every OBGYN, when they do an exam, to provide the patient with a handheld mirror and point out, this is your clitoris, this is the labia minora, this is the labia majora, this is where your problem is coming from. Let me open the speculum and show you what we have going on. Now, if you did that, we're going to begin to change the landscape as it means for women in the United States and in the world. But that was a little off, but that's kind of a little bit of a reason why I feel that the shame still exists.
What you said is so important, and that piece of audio right there should be reshared. You are 100% right, and it begins with knowing your own body and being knowledgeable of your different genitalia, of the different areas within, and really understanding that. And knowledge is power. Now, what are the different requests you're seeing in your practice surgically?
I see all kinds of requests. I mean, I see non-surgical requests, I see surgical requests, I see everything. But I think the important thing that women need to understand as far as what are they really requesting, I often try to figure out what is the proposed question. What they're saying to me when they say, "Oh, I want to be a little bit tighter," what they're really saying to me is, "I want to feel my partner again. I want to have intimate moments with my partner again. I want to feel love. I want to give love." So we're treating a whole number of things. So it's not necessarily the procedures that we do, it's finding the right physician that does these procedures, because we're cosmetic gynecologists. Cosmetic gynecologists are board certified OBGYNs who have gone out to get extra training to address the modern day concerns of women. What are the modern day concerns of women? Well, I'll tell you this much: when it comes to women's sexuality, it's been set on a bookshelf and hasn't been touched since 2020, maybe. When the last time I've heard a patient being asked, how are your orgasms? How are you feeling? Do you feel as though you can have intercourse the way that you would like to? So we are addressing the unproposed questions that women want the answers to. And so as far as procedures, we're doing whatever it takes to address the modern day concerns of women. That's the procedures that I personally try to achieve.
Amen to that. Now, what category of women seek your services? I mean, do you see more regular women, models, actresses, porn stars? Curious to know also about the median age of your patients.
Yeah, so the women that I see are women who have said, you know what? Sex is not a want, it's a need. It is something that I desire, it's something that I want to improve upon, and it's something that I'm supposed to have because I'm able to thrive, because I'm able to have enjoyable intimacy. So if that's the patient I see, I'm seeing celebrities, I'm seeing porn stars, I'm seeing soccer moms, I'm seeing my Davis community moms. I see all women because all women are deserving of this, right? And so what I really want to get out is not necessarily, okay, come see me and take care of me. What we want to do is change the landscape for women so that they can go anywhere they want in the United States or world and have their modern day concerns addressed. That's the
which
woman I
which
see.
currently they're not being addressed. Now, we'll go back to one of my favorite products that is sponsoring the segment, CO2Lift V. Now, CO2Lift V, it lifts, it hydrates, rejuvenates in just 3 applications. I'm a huge fan. Helps tighten and lifts it all, basically using carbon dioxide. It's so simple. I gave it a shot and I found that it enhanced circulation down there undoubtedly by rushing this oxygen-rich blood to tissue as described, and you can actually feel it. This is very regenerating, and you can actually see the transition over the course of the month. It improves sensitivity and lubrication. This was my experience. Now you're a well-known cosmetic gynecologist, all about vaginal rejuvenation. How do you feel about carboxytherapy for the vagina, and what are the best use cases for the vaginal treatment?
Carboxytherapy is a game changer. I first encountered it in my travels to the Philippines, Jamaica, India, and the Middle East. It's something that's been used in other countries, but usually it's given as a gas. When I found out you could do carboxytherapy as a gel in the privacy of your own home, I had to learn more about it. And when I began to learn more about it in terms of the gel application, I was pleasantly surprised. Most of the patients that I use this cream on fall into one of the few categories. Number one is the woman who comes in with her husband and she's saying, I can't have intercourse. He can't touch me. It hurts. It's almost like it's weeping. And I tried to examine her. There's no possible way to examine her. But yet, I have carboxytherapy, which she would be able to apply. And I have her apply this specifically. It's real easy. You just mix one big pack with a little pack, mix it together, put it on the vulva, put it in the vulva, and go to sleep. Wake up the next day and wash it off. I have them do this for 10 days. And when they come into the office, I am now able to do a thorough examination. I'm able to put that mirror that we talked about in front of them so that she can see and understand her anatomy and understand the processes that are occurring. So that's one case, and we call that genital urinary syndrome of menopause. Another case that I use CO carboxytherapy is patients that are suffering from lichen sclerosis. This is an autoimmune disease. This is a disease we really don't completely understand, but it causes terrible itching. It can cause discomfort. It can make orgasms difficult to achieve. It can make it such that you can't be intimate, even personally or even with your partner. And so we're stuck in the same situation. But carboxytherapy can really help because it improves the collagen, the elastin, and new blood vessel growth, which then increases the integrity, the resiliency of the vagina, and also allows me to continue treatment. Lastly, the person that I use this on is the patient who has come to me and says, I wanted a labiaplasty, and I took the brave jump. I went against society and said, I'm going to do this. They do this, and a poorly executed labiaplasty is performed by another surgeon. They come to me, and I'm able to do a procedure in which I'm able to fashion new labia from when there were none before. And so the healing properties of CO2 lift are remarkable. So they get a 5-day treatment. So I have a patient coming in very soon where we'll do 5 days solid treatment of CO2 Lift V to help with healing. So the places that I use it are healing, lichen sclerosis, genital urinary syndrome of menopause. But when you think of all of those things, we are helping women, we are helping the modern day women by having this tool, CO2 Lift V. This is a new tool that wasn't present before, but is now present today. And this is along the same things that we need to teach all gynecologists about, not just
You have me
cosmetic
sold. You
gynecologists.
have me sold. This is a miracle product. The but the explanation you just gave on lichen sclerosis, which to your point is such an inflammatory condition that is not very well understood. The fact that this could mitigate the pain and the discomfort associated with lichen sclerosis seems very, very proprietary and sustainable. Now, let's talk about the benefits. We have about 2 minutes left. The benefits of having consistent sex. So, for starters, pleasure and better sleep as your body releases oxytocin, also called the love or intimacy hormone, and endorphins during an orgasm. And the combination of these hormones act as sedation. But really, how important is intimacy in a relationship from your perspective?
Intimacy is very important to a relationship. There's a triangle of love that I think that there's an important triangle that needs to be in place. At the top of that triangle is love. To the right of that triangle is sex, and to the left is romance. So sex is important. If you don't understand it, We need to educate you, but again, sex is not a want, it's a need. And so to have the intimacy and to be closer is why the easiest way to say it is if you can be in a relationship where you respect love, romance, and sex, you can experience a slice of heaven here on earth.
You should write a book and coin that. Hallmark right there. That was the hallmark moment, Dr. Reed. Now, it's true. In a study of immunity, listen to how spot on you are. In a study of immunity in people in romantic relationships, people who had frequent sex 1 to 2 times a week had more immunoglobulin A, IgA, in their saliva. And people who had infrequent sex, less than once a week, had significantly less IgA. And
Mm.
IgA is the antibody that plays a role in preventing illnesses and is the first line of defense against human papillomavirus, right? So it's all correlated. Now, what's the average cost? Very quickly, like I said, about a minute left, and then we have the I would nevers. But what is the average cost of a vaginal rejuvenation in office procedure these days?
Well, so that's a difficult. See, every procedure I do is in office under local anesthesia. I can tighten, I can do everything. I can do non-invasive surgical procedures, CO2 Lift V. So the price could be from 1,800 to 100,000. I don't know, whatever it is that it takes for you to eliminate that cognitive dissatisfaction is what it is.
There are
Uh,
solutions as little as
so there's solutions.
$1,800, ladies.
That's right. Not too low, but yeah, we can get you in there.
Yeah, listen, for the cost of 3 Botox sessions, you can have a very, very looking vajayjay. Now, as a cosmetic gynecologist, let's do this. I would never, please list 3 things.
I would never get a labiaplasty done in the hospital under my insurance in the hospital by an undertrained or poorly trained physician. That's one I wouldn't do.
Yes.
Yes. The second thing is I would run away from any physician that told me that I couldn't use vaginal estradiol. Vaginal estradiol is safe for those breast cancer survivors, uterine cancer survivors, and vaginal estradiol can help prevent UTIs, vaginal dryness. And so any doctor that tells you, no, you can't use that, they're not savvy. I'd run from that one as well. Lastly, the person I would run from is the physician who is trying to sell you something. We're not trying to sell anybody anything. We're not charlatans. We are physicians who are listening to the modern day concerns of women. We want to change the landscape for women. So find the physician who will listen to your concerns, willing to ask questions, and willing to find solutions. That's all I got.
Well, that's everything. Now, if only there were 10 of you, but there's
Well,
only one
hey,
and you're in California.
listen. One of the things that I'm trying to do is create more gladiators that are like me. And what does that mean? What have I done? I created an institute. It's called the Institute of Restorative and Cosmetic Gynecology. It's a training institute. I will teach any physician how to do these procedures. I'll teach them how to talk to the patients. I'll teach them everything they need to know. I'm out here wanting to change the landscape. Honestly, I want to because
I
it
see,
needs
I
to be done.
hear, and I feel your passion. I can
These
truly, it's
doctors can come
radiating.
and they can pick my pockets. I'm going to give them everything and anything because the more doctors we can send out, the better and quicker we can change the landscape for women.
Well, we are out of time officially, my dear friend. Thank you so much for such a transparent, informative, and all around great, great educational interview. You are amazing.
Thank you very much.
That was our Going Deep segment brought to you by CO2 Lift, and that was the amazing Dr. Michael Reed, also known as the Cosmetic GYN. You could head directly to their website at thecosmeticgyn.com, or you can check them out at labiaminorareconstruction.com. Of course, Institute for Restorative and Cosmetic Gynecology is ircgusa.com. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2Lift. CO2Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2Lift, go to CO2Lift.com.